It's a warm welcome here in our studios in Serekunda. This is Star TV News and I am Sarah Kamara. In the headlines tonight, Maria Makunda and Tintinto benefit from Big Apple donation in the fight against coronavirus. Star FM, Star TV donates sanitary tools to Nema and Sinchu Alaji in the fight against COVID-19. The Gambia famous musician Attack donated food items worth over $60,000 to 3 communities within the Kanifing municipality. And on the international scene, COVID-19 puts Libya's health service in danger of collapse. U.S. braces of hardest week in coronavirus fight. Nigeria aid workers warn 2 million displaced at risk of COVID-19. Those were the headlines, and now the news in details. On Friday, the Chief Executive Officer of Big Apple donated over 140 bags of rice to 2 vulnerable communities in the Gambia as part of measures in combating the coronavirus pandemic. Modu Baji was there and he now reports.
Staying home as a way of preventing oneself from the COVID-19 is advisable, but it may also have a greater repercussion in countries where people's daily meals are determined by their daily earnings, hand to mouth. Moreover, the CEO of Big Apple, Aziz Yusuf, and his family deems it necessary to join the battle against the COVID-19 pandemic by donating to vulnerable communities such as Maria Makunda and Tintinto village. The beneficiaries were poor elderly people and widows. Mariama Sonko outlined her husband's efforts towards this laudable gesture. She revealed what motivated them to donate bags of rice.
But food is very, very essential. You can't stay home with empty stomach. Think about the children, think about the old people, and even the young. So food is very important. If you ask me to stay at home without food, I can't. I have to go out to look for this food. But once you have the rice, like I said, the other things are not that much big of a deal. You can always go to the nearest market or even a neighbor if they're having a garden to get these ingredients. But the rice is very, very important. So we thought about rice. We have to think about people eating, because I can remember when I was telling him, look, they said people should stay at home, but what about food? I mean, hunger can kill faster. If I'm at home, I'm safe from the corona, but what about feeding? So we thought about this, and he said, okay, fine, we'll do 200 bags. We'll give Maria Makunda 80 bags. We give Tintinto 70 bags.
Mrs. Yusuf urged those with the financial muscle to consider the less privileged families in order to enable them to stay home in these trying times. Kemo Alhaji Kamara served as the coordinator during the donation. He emphasized on the need for this gesture and how it will help in the fight against the COVID-19 pandemic.
Foodstuffs to the people of Madam Makunda and Tintinto by virtue of the fact that recently people are not moving about, and most of the people in these communities, they live from hand to mouth. Their possessing power is very, very weak. So he has the feeling that there is need for people to come out and give assistance to these people. And one essential thing is what is food, provision of food to the people. Because these people, they need food. Without food, they will go out. Because the reason why they are trying to stop people from going out is to circumvent them from contamination. Because this disease is contagious. But one essential thing that can keep people from going out is to have food in their houses. Because without food, you can't keep them. They'll go out. They'll go out and look for food. And going out to look for food, they must get in touch with people. Who knows? The people you are getting in touch with, maybe they have the disease. But if you provide them with food in their houses, they'll keep themselves away from the general populace. So that's a way of preventing people from getting the disease. So I think that this is a very good initiative.
However, elders from these 2 communities also took time to pray for Mr. Yusuf and his family. They also indicated that this gesture came at a time when they are in need of such support. Reporting for Star TV, I am Modu Elbaj.
The management of Star FM, Star TV on Thursday gives out sanitary materials to the people of Nema and Sinchu in support against the fight of the pandemic COVID-19. Both villages pledges to be supported with sanitary materials through Star FM Wake Up Gambia program. Omar Diop has rest of the details.
Speaking at the presentation ceremony, the managing director of Star FM Star TV, Sarah Kamara, said the management of the institution were notified about the need of the sanitary materials through Kausubaji and they deemed it necessary to provide the item. The institution early created a platform through the Wake Up Gambia show to call for pledge in support of the fight against the coronavirus. Meanwhile, Alpha Karaga, CEO of Star FM Star TV, said a similar remark by thanking the women of Nema and Sinchi village for coming to their institution in this trying moment to help them with the necessary materials which will help in the fight against the epidemic. Mr. Karaga also advised the women to adhere with the guidance given by the health authorities to help fight the coronavirus, which involved the constant hand wash with soap and to observe the social distance. He concluded by saying the institution wishes to give out more as the other sanitary materials will be taken to the rural areas. Sukanjai, a resident of Suncho Alaji and a beneficiary, said they were pleased to receive the sanitary materials as her people put their hope in her to provide the hand washing tanks, and that's why she also sought to start FM Star TV for help, which the institution came to their aid. Speaking on behalf of NEMA, Ajifatu Mboj said since the pandemic, NEMA downside have been left out as no philanthropic or institutions came to their aid, which is why they call on Star TV, Star FM to help them with hand washing tank, and they are pleased to receive it. Ajifatu further stated that they see NEMA as NEMA A and NEMA B, which NEMA B being poor and always ignored in hard times, especially the coronavirus crisis. For Star TV News, I am Omar Diop.
On Sunday, famous Gambian musician Attack donated food items worth $60,000 to 3 communities in KMC. Speaking during the handing over ceremony, Sheikh Tijan Jaju said Abdou Gay's Attack donation is one of goodwill and with the intention to help the needy in the fight against COVID-19, but not for prominence. Maimuna Juf reports.
Known for his charismatic musical performance, the young star also joined the campaign in helping the vulnerable communities in ways of staying home by providing food items to the people within the Kanifing municipality. The donor Abdou Gay, commonly known as Attack, highlighted the coronavirus is not only affecting people's health but also the economy of the country, which necessitated for him to act.
It came across our mind for us to do this just to help out those who needed it. You know, we did not do this to show off. We did this just to help, to let people know this is what we should be doing. Like each and everybody, it doesn't matter what you have, you just have to share and give out. Like especially these times, like everybody is needing something to eat, you know, something to drink and all that. You know, being a good health service is not only to give out healthcare to the people who are affected, but they also need this. Like they truly need this. This is all we can do right now, because we know if we do it, you know, it's essential, it's important, you know, and it's a good looking to people from this environment, the community. They appreciate it, and we are looking forward to be doing this kind of initiatives, even if not for these times, you know. It has to be occasionally, or even if we are doing something in partnership with the communities just to help out the people living in the environment, you know.
Attack thanked his team and fans for being supportive during the past years. The donation of these food items benefited 3 communities in the Kanifing municipality, namely Ibo Town, New Joshua, and Laterkunda. Speaking to Star TV after the official handing over on behalf of the beneficiaries, Ajifatu Kamara thanked the team for what she called a timely donation, as they were not expecting such at a time. She indicated that some of the household heads are thinking of how to feed the families in this moment of a global pandemic. The support will go a long way to support the feeding endeavor by some families. Reporting for Star TV News, I am Maimuna Juf.
And now, news beyond our borders. The coronavirus pandemic has forced schools around the world to close, with students continuing their education online. But many of them in some part of Africa are missing out because the resources are not available. Al Jazeera Catherine Soy reports from Mungwi in eastern Kenya, where thousands of students in urban informal settlement and rural areas are struggling.
Maybe we will skip this part.
This is the new normal in many schools in Kenya.
We are doing a quick check-in before the lesson starts.
And Julius Masharia is settling into the idea that he might be remotely teaching his students for months.
My machine has hanged.
Some of the challenges we're experiencing.
He's dealing with a few technology glitches and the fact that not all children might give 100% in virtual classes.
Ivana, take us through the slide.
But he says the coronavirus has shifted the future of learning.
Majority of them are now organizing some groups that they're doing their own discussions on Skype, they're doing discussions on Zoom, and engaging teachers in ways that actually are unimaginable.
About 150 kilometers east of Nairobi, in Mwingi, this parent homeschools his daughter.
Southeast. Did you get that one correct?
He uses a television learning program started by a government institution, but it's not easy.
You know, the program which is coming on TV, you cannot follow it up to the latter because sometimes the kids want to relax, and sometimes they tell you that you want to go out.
Tens of thousands of students across the country are now adapting to virtual studies on TV, radio, or online. But many have no electricity, internet, or devices to keep up. State school students are suffering the most. In 2013, the government promised free laptops to primary schools, saying it would gradually expand the program to secondary schools. But that project has been slow to implement.
Coronavirus has disrupted every aspect of life. Education has been badly affected by the disease, and with schools now closed indefinitely, many children are likely to lag behind in their studies.
Rachel Mbathe recently entered secondary school, but now she's back home and her day is full of housework and chores. She lives with her mother and siblings, and today the only meal they have is fermented porridge. In school, she'd have had 3 hot meals.
I don't have a working radio or TV. I don't even have a computer to listen to those learning programs. I'm afraid when I go back to school, I'll be behind the children who have those devices.
The only time Mbathe gets to revise is just before sunset, and only for a little while because once darkness sets in, she's limited. With no electricity and money to buy solar lanterns, she uses flashlights. Her story echoed by many others across the country. Catherine Soy, Al Jazeera, Mwingi, Eastern Kenya.
Libya has so far avoided the worst of the coronavirus with just 17 confirmed cases. But with a war raging, the health service could be in danger of complete collapse if the virus spreads. There is now a race to get more equipment into hospital to help cope with the major outbreak. Al Jazeera Mohammed Abdel Wahid reports from Tripoli.
In the fight against COVID-19, the one and only medical factory in Libya based in the city of Misrata is now dedicated to producing protective gear. That includes medical gowns, face masks, shoe covers and other similar products. Staff who are striving to meet the government's needs say they have increased production of face masks from 7,000 per day to 40,000.
We are currently providing for general hospitals and a few private clinics, as they are the ones who will be dealing with corona on the front lines. We have doubled our staff and have increased production. We have a serious problem with bringing in the raw materials, but we are doing everything we can.
In the capital Tripoli, medical workers denounced a shortage of medical and personal protective equipment. As the virus sweeps the globe, several new cases have been registered in Libya. The health system here is already weak, and with the country at war, there is concern hospitals won't be able to cope with the added pressure coronavirus could bring.
I urge both parties and all others directly and indirectly involved in this conflict to immediately halt hostilities, to allow authorities to effectively address the COVID-19 threat, ensure unhindered access to humanitarian aid, and realize the ceasefire they have been discussing under the auspices of the United Nations.
With nearly 1.7 million people already in need of health assistance in Libya, and high numbers of migrants and internally displaced people. Organizations like the International Rescue Committee are warning that an outbreak of COVID-19 could have a devastating impact.
The year-long military campaign on Tripoli by forces loyal to the warlord Khalifa Haftar goes on. According to the United Nations, more than 280 civilians and about 2,000 fighters have been killed. The war has displaced about 150,000 people. While the war continues to claim lives, the staff at this medical factory are working round the clock to make more protective equipment for doctors and nurses. They're putting in extra hours for no additional pay. They say they don't want more money, they just want to help save lives. Mahmoud Abdul Wahid, Al Jazeera, Tripoli.
President Donald Trump said the drugs chloroquine could be useful in treating the COVID-19 pandemic sweeping across the country as deaths in the United States approach 10,000. Anti-malarial drug chloroquine has not been proven to work on the coronavirus, and Trump prevented the nation's top infectious disease official, Dr. Anthony Fauci, from answering when asked about the drug. Al Jazeera Khaidu Castro reports from Maryland.
Conflicting messages from the President of the United States.
We see light at the end of the tunnel. Things are happening. Things are happening.
And the country's top health officials.
The next week is going to be our Pearl Harbor moment. It's going to be our 9/11 moment. It's going to be the hardest moment for many Americans in their entire lives.
The U.S. Surgeon General warns many more people will die in the coming days. The expected surge adding urgency to the cries of state governors asking the federal government for deliveries of life-saving equipment.
So we, governors, Republicans and Democrats, have been urging the president to do what he should, which is if he wants to be a wartime president, be a wartime president. Show some leadership. Mobilize the industrial base in the United States. That's what we need.
Trump says ventilators from the federal stockpile are en route to several states and claims the U.S. has conducted more coronavirus tests than any other country. Per capita, though, testing in the U.S. is still far behind South Korea and Germany. Trump says the U.S. has stockpiled 29 million doses of an anti-malarial drug that is being used experimentally to treat COVID-19. The president says he has so much personal confidence in the treatment that it was his idea to have patients waive the right to sue if the drug ends up doing them harm.
That's hydroxychloroquine and azithromycin. And again, you have to go through your medical people, get the approval. But I've seen things that I sort of like. So what do I know? I'm not a doctor.
When reporters later tried asking the doctor, Anthony Fauci, the government's top infectious disease expert, Trump stopped him from answering.
And would you also weigh in on this issue of hydroxychloroquine? What do you think about this, and what is the medical evidence?
That question?
Yeah. Well,
Maybe 15 times.
Meanwhile, doctors and nurses across the country continue to plead for donations of more masks and gowns, bracing for the apex of cases still to come. Heidi Jo Castro, Al Jazeera, Maryland.
8 workers say close to 2 million displaced people in camps in northeast Nigeria are at risk of contracting the new coronavirus infection. They have all been made homeless by 10 years of war with Boko Haram. Charity organization says poor nutrition, lack of proper sanitation, and overcrowding are common problems in the camps. Al Jazeera Ahmed Idris reports from Abuja.
A sprawling camp for the displaced in Maiduguri. It's one of dozens dotting the landscape of northeastern Nigeria. In some of the camps, aid workers hand out soap and water in a race to improve personal hygiene as more coronavirus infections and deaths are reported.
People are complying very well. The level of compliance, as you can see, is here.
The securities at the gates are quite around trying to enforce. In fact, I even cited somebody who wanted to gain access to the camp, and then the person actually declined to wash his hand, and of course he was denied access.
But the residents here are undernourished, with some having to wait in lines to fetch drinking water. Overcrowding is another major problem, making social distancing almost impossible.
There's no support or any donation that will encourage hygiene and healthy lifestyles, but yet they are still making emphasis on coughing etiquette and good personal hygiene. So how do you expect the less privileged in the camp to cope with this situation?
We are always praying. That's all we can do. This is a test from Almighty God, so we ought to accept it with good faith.
10 years of war with Boko Haram, the group fighting against Nigeria's army has forced more than 2.5 million people from their homes into camps like this. The United Nations announced emergency response measures to mitigate the spread of coronavirus among the most vulnerable in the Northeast. But organizations such as Doctors Without Borders say the situation in the camps is dire. It's made worse by the continuing Boko Haram attacks, not only in northeastern Nigeria, but in neighboring Cameroon, Chad, and Niger Republic. Many fear a coronavirus outbreak in these camps could be catastrophic, a fear that's becoming more real with health facilities crumbling across the country. Ahmed Idris, Al Jazeera.
And before we end the news, a recap of our main headlines. Maria Makunda and Tintinto benefit from Big Apple donation in the fight against coronavirus. Star FM Star TV donates sanitary tools to Nema and Sinchu Alaji in the fight against COVID-19. Gambian famous musician Attack donated food items worth over $60,000 to 3 communities within the Kanifing municipality. On the international scene, COVID-19 puts Libya's health service in danger of collapse. U.S. braces for hardest week in coronavirus fight. Nigeria aid workers warn 2 million displaced at risk of COVID-19. That's all for this edition of the news. Please enjoy the rest of our programs and join us tomorrow for more news. Thank you.